talk about lung diseases. Lung diseases are classified into obstructive lung disease and restrictive lung disease. Obstructive means causing a blockage. Restrictive means limitation. Before going to definition, I will tell you 4 simple things to remember in order to understand the concepts better. So firstly, what is the structure affected in obstructive lung disease? It is the most proximal part, that is the bronchus and the bronchioles are affected. Bronchus, even trachea is also affected. And in case of restrictive lung disease, the lung parenchyma is affected. Okay, that is the first point. The second one is breathing difficulty. Now, breathing includes inspiration and expiration. So, in obstructive type of lung disease, expiration would be difficult. In restrictive type of disease, inspiration would be difficult. Okay. The third point is pathophysiology. So, in obstructive lung disease, the pathophysiology is the airway resistance. The resistance offered by the airways to the flow of air. In restrictive lung disease, it is the lung compliance. Lung compliance. Compliance means expansion. So, that is where the problem lies. There is decreased lung compliance in case of restrictive lung disease. Further, moving on to the fourth point, which is the pulmonary function. In obstructive lung disease, the pulmonary function, there is decreased airflow, and in restrictive lung disease, there is decreased lung volume and capacity due to decreased lung compliance. Okay, so these are the 4 points which will help us to further understand the concepts better. Okay, now moving on to the definition of obstructive lung disease. Obstructive lung disease is a respiratory disease characterized by airway obstruction resulting in narrowing of airways, and the restrictive lung disease is a respiratory disease that restricts lung expansion resulting in a decrease in lung volume, increase in work of breathing, and inadequate ventilation. Now let us see some examples in obstructive lung disease. Obstructive lung disease includes bronchial asthma, chronic bronchitis, emphysema, and bronchiectasis. In restrictive lung disease, the examples are further classified into extrinsic and intrinsic factors. Okay, now let us talk about the extrinsic factors. Extrinsic means the problem is not in the lung. The problem lies outside the lung, and hence it is also called as extrapulmonary factors. That includes kyphoscoliosis, which is a chest wall deformity which restricts the chest wall expansion or the lung expansion, thereby reducing the lung volume and resulting in inadequate ventilation. Further, diaphragmatic paralysis. The diaphragm muscle is one of the very important muscle in inspiration, and as I've already told, here in restrictive lung disease, inspiration is difficult. So, if the diaphragmatic paralysis occurs, there is further decrease in lung expansion, or Further, the lung expansion and lung volume both are decreased and work of breathing is increased. And now myasthenia gravis. Myasthenia gravis is a neuromuscular defect which restricts the lung expansion. Now let us talk about the intrinsic lung factors. So it includes lung fibrosis, scleroderma, granulomatous tissue formation, silicosis, asbestosis, pneumonitis, and interstitial lung disease. Now I am going to describe some keywords which will help us to define the conditions better. Talking about obstructive lung disease, first one is chronic bronchitis. The key words in chronic bronchitis are excessive tracheobronchial mucus production. Wherever there is inflammation, there will be mucus production. And now let us see the difference between a healthy and a bronchitis lumen. Okay, so the lumen of a healthy person, healthy bronchus, is clear, and the smooth muscles, you can see the difference. Here the lumen is narrow, there is inflammation and chronic infection. Okay, now let us move on to the clinical features. Clinical features include cough with sputum, winter cough and fever, chest tightness, breathlessness, and one more thing, chronic bronchitis is also called blue blotters because the person would appear blotted and blue. Blue because of cyanosis. Cyanosis means bluish discoloration of skin and mucous membrane. Another condition, that is bronchial asthma. So the important keywords are excessive tracheobronchial hyperresponsiveness. Allergens such as pollen dust, house dust, and other triggering factors such as tobacco smoke and cold air will trigger the trachea and the bronchus and will result in excessive tracheobronchial hyperresponsiveness. Further, moving on to the clinical features, the most important clinical features include dyspnea, cough, chest tightness, and wheezing. Next condition is emphysema. Emphysema patients are also called pink puffers because they hyperventilate and they look thin and pinkish. Okay. Here the keywords are distension of air spaces distal to terminal bronchiole with destruction of wall septa. Here first you can see the basement membrane of the alveoli and the acute inflammation going on. The acute inflammation results in destruction, which further results in chronic inflammation. In emphysema condition, the clinical features include gradually progressive breathlessness, sputum which is scanty, and these are the symptoms. Now the signs include distended neck veins and enlarged chest because they hyperventilate. That's all for today, friends. If you found this video useful, like, share, and make sure to comment below and subscribe to my channel for more such videos. Thank you.